really, I mean, you're the quarterback. You're the one that's making the decision. Have the comfort level. I mean, how do you have that conversation now versus how you used to have it?
I think that, like, when I see a patient that needs a total joint, I'm looking for something to convince me that I can't do it in the ASC. I mean, I ask them about their health. I ask them about a lot of different things, but my goal, my assumption is that every single joint that comes into my practice, anyone needs a total joint, is going to be done in our ASC. And the only way I don't do it in ASC, if there's something that sticks out, like a cardiac problem, or they have poor health, or they have something in their home environment that makes it very difficult for them, or they're one of those people that need to go to rehab, kind of a frail elderly patient that really can't go home that day because they just don't have the support system. So for me, I am, the conversation with the patient is basically like, tell me about your health, tell me about what's going on, what your average health is, and kind of what your home environment is. And if everything kind of checks out, they're going to the ASC. But my whole thing is, I'm just focusing on that. And I think that my discussion with the patient is always, private care, experienced staff, and away from infections. And I think that's a key element I think that we just provide a better model. It's just more private and more enjoyable for the patient.